Hi, it's Dr. Greg Morris from the Ultimate Foot Store on Talking Feet. And today we're going to talk about Achilles tendonitis. And it's a very common problem that comes to my office every day, is that we strain our Achilles tendon. And so our Achilles tendon comes from our calf muscle. And the Achilles tendon is our biggest, strongest tendon in our body. And it grabs on the back of the heel bone here. So it's part of the Achilles tendon here at the base of it, where we're attached on the heel bone, or the calcaneus. And we just strain it, walking, standing, running around our feet all day long. The Achilles tendon is taking a lot of stress, and it can just get aggravated. And the problem with this aggravated, it's very hard to calm down because we're always on our feet. We're always walking and standing, so it never gets a chance to calm down. So if any kind of tendonitis, it typically goes away in about 4 or 5 weeks if you can be nice to it. Well, it's hard to be nice to our foot. So whether you have Achilles tendonitis or plantar fasciitis, it's hard to calm down because we're always walking and standing. So the ways we get rid of it is, first of all, stretching. And so stretching the calf muscle. So the calf muscle up here, you stretch and massage the calf muscle, stretch and massage the Achilles tendon, but not too hard on the Achilles tendon. The calf muscle you can stretch and massage as hard as you want, but the Achilles tendon you want to be gentle down here. Even the bottom of the foot, the plantar fascia is related to the Achilles tendon, so stretching and massaging the plantar fascia helps with the Achilles tendonitis. So the biggest thing typical, calf, 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 stretching and massaging the calf muscle, that's what really helps with Achilles tendonitis and also plantar fasciitis. If people don't get better, a lot of times I send people to physical therapy when I want to get in there and kind of break down that calf muscle. So to massaging the calf muscle hard by yourself, or using one of those massage guns or any kind of roller, and massaging the calf muscle up here, and kind of get aggressive on massaging there. And if you can't get better, we send people to physical therapy. On the tendon itself, well, you can try icing it down. You can try using warm water soaking. Like using, we call it diclofenac gel or Voltaren gel, which is over-the-counter gel. That's basically Advil or anti-inflammatory in it, and putting that on the Achilles tendon works very well. Very well. And then once again, inside the house, if you go around barefoot, we're putting a lot of stress on that Achilles tendon. So wearing a nice slipper or sandal around the house has a little bit of cushioning, little padding, little heel or lift to it, makes a big difference. Especially around the house. You're walking barefoot, you're putting a lot of strain on that Achilles tendon. With the little sandal or slipper, takes the stress off of there. Especially Achilles tendonitis. Wearing a pair of sandals or slippers, a little heel or a little wedge to it, a little half-inch, inch and a half little wedge, will take the stress off the Achilles tendon and the calf and help out a bunch. And then once again, wearing a good pair of walking shoes, a little bit of cushioning and support. And most shoes typically have a little lift in the back, which takes some stress off of there. And then wearing a little arch support, or like even a temporary heel lift can take some of the stress off the Achilles tendon. And then I like people exercising, but you just gotta be smart. If every time you go for a walk or run, it's getting aggravated, it's painful afterwards. Because the problem is, a lot of times with tendonitis, it's sore at first, and you start walking or running, and it warms up, you don't notice it, and then the next day it's really painful. And so you gotta listen to it. It's like, it's really painful that day, so maybe I'll tone it back. I won't go as far as a walk or a run. Make sure you do a lot of stretching and massaging afterwards. Ice it down after you, or ice or heat back and forth. You try the Voltaren gel, and then maybe take some Motrin or Advil. Once again, activity modification, especially the Achilles tendon. Walking quickly, doing hills, running or jumping puts a lot of stress on the Achilles tendon. So if you're gonna walk, go for a nice flatter, easier walk. Take it a little slower pace. Make sure you stop and do a lot of stretching and massaging before and afterwards too. If you do that, typically the Achilles tendonitis goes away. If you continue to aggravate that Achilles tendon, you can damage the tendon, get like a partial tear, or we call it tendinosis, which can be a long-term problem. So taking care of those problems right away is a very good idea. So once again, Dr. Gregory Morris at the Ultimate Foot Store at Talking Feet. We'll see you again next time.